Welcome back to What's Your Take? Real talk on leadership and life. I'm your host, Dr. Nikki, the DBA pharmacist, healthcare leader, and founder of FitBiz Global Solutions. This episode is part of our Expert Spotlight series. In these conversations, I sit down with leaders and innovators across different industries to talk about how they navigate change, how they lead with purpose, and how they move vision into real-world impact. This is part 2 of my conversation with Dr. Ciara Morton-Mitchell on innovation that actually works, leading digital transformation in healthcare. In part 1, we explored the foundations of digital transformation, from proactive leadership and governance frameworks to the role of trust and stakeholder engagement in high-stakes environments. In this part of the conversation, we take a step further. We talk about what innovation that actually works looks like in practice, how leaders navigate resistance to change, and what the future of digital transformation in healthcare may hold. So let's jump back into the conversation. Dr. Ciara.
Again, thank you for inviting me to your podcast.
So let's switch into innovation. When you hear the word innovation, it is often framed around speed and disruption. There's that disruptive innovation as well, right? But from your perspective, what does innovation that actually works look like in practice?
In practice, I would say innovation that actually works is not defined by the flashiness or the complexity of the technology or even the speed of the implementation or the launch. In my experience, it's defined by the scalability, the sustainability, and most importantly, the trust that is garnered and the buy-in that's garnered in what's being implemented in the innovation. And in my experience, innovation in practice is often the result of the strategic work, or what I would think most people would think is the unfun or the boring or the unsexy work, essentially the structural engineering of the organization itself, which in my eyes lies mostly within, a PMO wheelhouse within an organization. And so with that, I think real innovation requires a disciplined PMO framework and SDLC standards to act as the engine for the clients. And in the firm I work for now, innovation works because we've moved away from the firefighting culture, as I keep referring to, towards a progressive, proactive, governed environment where technical delivery is predictable and repeatable, essentially a wash, rinse, repeat culture. And also in my research recently published highlights that if the human element does not trust the system and the innovation, then the innovation is effectively a failure. And basically the stakeholder buy-in, like we keep referencing, innovation that works is designed with the user's workflow in mind. They're kept apprised throughout the life cycle of those key decisions that are being made, how the current state to the future state of their workflow is changed. And that could be technical. In healthcare, it's like, if you're adding a button, the stakeholders should see current state, the button doesn't exist, future state, the button does exist. But I think it also transcends into operational change management as well, of current state process flows to future state process flows, and having those discussions around that strategically so that we get the buy-in from the less technical focused senior leadership and we get buy-in across the board. So I think that whether it's an epic workflow for a nurse or a DFM design for an engineer, we need to ensure that the technology supports rather than disrupts the human decision-making. And so in all that I've learned thus far, the most successful innovations are those that anticipate the risks and compliance needs before they become roadblocks. And regardless of the industry context, to me, it looks like investing in the architecting of the systems and processes that are built for the long-term growth rather than just the immediate technical fixes.
That was a great explanation. How do you balance the short-term operational demands with long-term transformation, especially when teams are already stretched?
When balancing the short term with the long term, I think that's where leaders I've worked with have struggled, because they often, as I've seen, treat them as two separate items. I think that's appropriate for some cases, but For most cases, maybe it's not. And I say that because I view the balance of the two through the lens of architectural integrity. So meaning that you can't build a skyscraper, which is a long-term transformational goal, if you're constantly repairing a cracked foundation or the short-term operational chaos. I say that with the current space with DFM, where it's switching from the firefighting culture to looking at the long-term goal, basically removing the noise. And in my experience in leading implementations, the teams are often stretched because they're stuck in a reactive loop of manual tracking and disjointed communication. At my current firm, I've again moved our clients away from legacy tracking and disjointed systems, flying blind, and moved them into an integrated cloud-based analytical tool set. This has reduced the administrative tax and the cognitive burden on the technical team, and it frees up their bandwidth to focus on high-value transformational goals. I don't treat transformation as a special project or in a silo. I think that it's best to work to integrate those standards into the workflow. And I pay special attention to bake it into our unified standards by establishing a disciplined PMO infrastructure so that the short-term work is performed so efficiently that it naturally feeds into the longer-term scaling objectives.
You mentioned earlier about innovation and buy-in, and I just want to explain it because we're talking about a professional workspace. Mm-hmm. And think about when you said that we have to ensure that the people who are implementing, something I found in my research as well, people who are implementing technology, they have buy-in. It's like if someone produces a new product for the general public, the customers out there, if they don't show people who are buying every day, they're going to have no sales. Like we see this every day. You come up with something new. Usually when it's probably trendy, you're going to get those uptick in sales. If people cannot see the value in something, they're not going to pay for the item. So I think it's in the same vein when you're working with people within the organization trying to implement technology or you're trying to be innovative. That's very important. It also comes down to the organizational culture and how people adapt to change. You know, sometimes according to that organizational culture, they're not used to it or change is just not part of their structure. And we know for things to be successful, the hardest thing to do is to change people, their mindset. Right. It's actually one of the most difficult things.
Yes.
And speaking of that, I know that inevitably resistance will be a part of something, okay? Can you share an experience where you encountered pushback? And that could be a system, a team, stakeholder. I want to know how you navigated that moment as a leader. It can be interesting. Different people have different takes on that.
Yes. So you already know within healthcare, changing a button, changing a word on a screen introduces risk, but it can be absolutely no buy-in, complete resistance to change. Have been there, done that on the healthcare side. And to mitigate that on the healthcare side, you know, from the start, having the level setting, being a leader within the healthcare space previously, grounding the internal project team to we are all on the same page of understanding the exact scope and ask of the question of what they're wanting, the clinicians, whoever is putting a request, understanding the scope internally, and then taking that forward facing to the client, to the stakeholder, confirming what they want, and keeping them engaged and apprised and in the front seat throughout the life cycle of the project so that they are front and center for any decisions being made, every question that's being asked. They have ample opportunity and time to speak their mind, to ask their questions, to provide any of that pushback. And that is how I've essentially navigated that as a leader on the healthcare space, is not letting the technical team and the stakeholder team act in silos. It's bringing them together and being a facilitator and a leader and having those uncomfortable conversations at times where we are not forcing, but encouraging and pushing a change forward that inevitably impacts the end user, stakeholders, and coming to a middle ground and understanding and communication and just understanding that it is a fear of change. So working with that on both sides, the technical team and the stakeholders, switching to this space here where PMO structure is going to vary greatly because it's not a regulated space like healthcare.
That's interesting because healthcare is such a structured environment. Did you see a different kind of resistance when you started introducing PMO frameworks in the engineering space?
In my work thus far in the engineering firm that I'm at, in architecting the PMO infrastructure, I have encountered significant pushback, and it's been almost like a pendulum to me of the pushback of this is too academic of having a PMO. I don't even know what a PMO is. I don't know what an ePMO is, over to the side of, this is what I need, but not knowing that this is what I need. So with the company, the clients that we have, like I've mentioned, they are very reactive firefighting culture. That's just how our portfolio seems to be with the clients we have. When I began introducing the unified standards and the formal governance, the initial response from the internal senior leadership was that this is just administrative red tape and it would slow down their technical delivery, which is how they, make their money. And in understanding that, I've navigated the challenge in leading with empathy and evidence. And so I did not push the process. I listened to their pain points, and I used my doctoral research on trust to understand that their resistance was not to the system, but to the perceived loss of autonomy and how they're operating. And so to win them over, I started with visuals. I'm a visual person, so I started with visuals, timelines, Gantt charts, colors, and things of that nature to show this is glaringly obvious. You need to focus on this. It's red, or we're in the green here, or this is yellow. Let's slow down and look at this and come up with a game plan to mitigate the risk here. So starting with visuals, I migrated over the legacy tracking to an integrated cloud-based analytics platform so that when we're tracking one part of the ship for product delivery, it is dynamically updated to the other side so that we are all in lockstep with each other to see the downstream waterfall impact of the timeline and real-time reporting of the active initiatives and issues. And in doing this has eliminated the busy work of the status updates of the engineering team and leadership and flying in the dark, and ultimately freeing the technical team and all the stakeholders at play to focus on the high stakes decisions and engineering at hand. And so in me taking a proactive stance and leading this change, to be successful in doing this, I've taken parallels that I've seen from epic transformation in healthcare and explained that we are not adding brakes or bureaucracy, but we are building a racing harness or guardrails, if you will, for risk mitigation, and then showed them that a disciplined PMO framework is what allows an organization to scale without breaking its technical integrity or the speed. So as a result, by focusing on the transparency and the trust that I've instilled with the clients, the pushback has shifted into a partnership. So they've realized that the infrastructure was not there to police them, but instead it's there to support them in their long-term strategic goals.
I was chuckling with some of that you mentioned. And I like how you talk about empathy, because empathy is one of those leadership skills that we need to use a lot in that healthcare space as well. So you definitely took that with you. Because you're in that engineering space, I'm not surprised about the visual aspect that is needed. Yes. I do have siblings in the engineering space, and the Gantt chart and all these, I remember back in the day in university, that's definitely something that was used. So it probably speaks to the profession and the training and the things that work with their mindset, whereas they may not understand or see the necessity of what we have to do in healthcare for what they need to do in their engineering space. So I perfectly understand. So I just want to switch to one of our last little segments here about quickfire reflection. Looking back, what's one leadership lesson you wish you'd learned earlier in your career? I like to ask that question to all of my guess. What's your take on that?
Early on, I learned that I didn't need to choose between being a technical expert and a strategic leader. I learned that actually my greatest asset is being in the intersection of both. And before, I thought my job was simply to be, the best I could be within software implementation, more on the technical side, the specific build, technical tasks at hand. And I didn't really realize that my mission was to actually architect the frameworks and infrastructure that allow others, like the technical experts, to succeed at scale. So I used to think that soft skills like trust and culture are separate from hard skills like the SDLC standards or the PMP methodologies. But in my research, I learned that developing trust in AI has proved that they're actually the same thing. My research focused on developing trust in AI, and I realized in that research that they're actually the same thing of having those different sets of skills. And I would say that you can't have one without the other in a complex, high-stakes system, in my experience thus far. So whether I'm in a hospital system or engineering plant, I don't just manage projects, and I think that architecting proactive environments has been actually very fun. And I think that looking back early in my career with the projects that I was involved in, I think I just would have been a little bit nicer to myself and not trying to think I needed to know every technical answer, but be more comfortable being in the intersection between the two, strategic and technical.
Absolutely. And, in this world of emerging technology, I want to talk about that one. What gives you hope when you think about the future of digital transformation in healthcare?
Honestly, what gives me the most hope is seeing the shift from technology for technology's sake to a world where we finally prioritize the human-centered infrastructure that makes it all work. And I think we are moving past the hype and entering a phase of intentional maturity. So I'm inspired by the growing number of leaders like myself and you who are bridging the gap between deep academic research and the high-stakes operational execution. And I think that we are no longer just installing systems, we are architecting trust. And so ultimately, my hope is grounded in the legacy we're building for the next generation. And as a mother of 2 young girls myself, I think one day they'll have children of their own, and I want them to enter a world where technology is seamless, trustworthy, and it's a trustworthy partner in their well-being and not a digital burden.
That's excellent. This has been such a thoughtful conversation with Dr. Ciara. What really stands out to me is how clearly it reinforces a truth we don't talk about enough, that leadership transcends tools and titles. Whether we are talking about healthcare systems, digital platforms, or organizational change, what matters most is how leaders show up, how they listen, and how intentionally they guide people through change. Dr. Ciara's work reminds us that innovation isn't about chasing trends. It's about building systems that serve patients, support teams, and sustain impact over time. I don't know if you have anything to add, Dr. Ciara, just before we do our final wrap-up. You can connect with Dr. Ciara on LinkedIn at Ciara Morton. And if this episode resonated with you, I encourage you to share it with someone navigating change in their own leadership journey, or tag me with your biggest takeaway. So that's a wrap. Dr. Ciara, you had anything else to add?
I just wanted to thank you again for inviting me to your podcast. I think this is a great thing, and I'm excited to see it to continue to grow in your following. And just thank you again.
Thank you. Absolutely. As always, to my audience and listeners, thank you for tuning in to What's Your Take? Real talk on leadership and life. I'd love for you to follow or subscribe wherever you're listening. Share the episode with someone navigating digital transformation in their own leadership role. And stay connected at fitbizsolutions.com on social, Instagram at fitbiz.solutions, Facebook, FitBiz Solutions, and YouTube, FitBiz Solutions Media. New episodes drop every Thursday with more powerful conversations and perspectives ahead. Until next time, keep evolving, leading with intention, and always ask, what's your take?